Hi, everyone. This is Hilary and Kristin over at Main Access Points. And we are here to have a conversation, just checking in about COVID-19 and the impacts in our community, some updates, and some of the best practices that we've come to learn from our teachers and different ways that we can keep each other and keep ourselves safe during this time. So we can do kind of maybe quick introductions. My name is Hilary. I work at Main Access Points. I use the pronoun she and her. For folks who are joining us this evening, feel free to use the chat box to or make comments, and we can go through and make sure that your questions get answered. And I'll pass it off to Kristin to just introduce herself quickly, and then we'll talk a little bit more about what we're going to be spending our time together with.
Thank you, Hilary. Hi, everyone. I'm Kristin, and I work here with Hilary and some other folks at Main Access Points. And yeah, we just thought it would be nice to check in and sort of create some space to talk about how everyone's doing and where maybe they've made some changes during this long time of the pandemic together, how we've kept each other safe and how can we continue to. So really everything we offer are just our offerings of what we've heard, like Hilary said. And we'd love to hear from all of you about how things are going. And I guess just giving ourselves permission tonight too to feel whatever way we feel about it as we talk through it too. It's really hard to find a gauge on how you're feeling right now through all of this that we're going through. So yeah, happy to be here with you, and I guess we'll get started.
Yeah, I think, it's always good to just give a little recap about what we do at Main Access Points. So we have a statewide overdose education and naloxone distribution program. So we can get you access to naloxone anywhere in the state of Maine, and are happy to do that through mail delivery and in-person delivery. We have 3 syringe access programs in York County, in Washington County, and in Aroostook County, where we have mobile outreach available to folks who are looking for safe use supplies. We also do aftercare and support. So if you've experienced your own overdose or have responded to someone's overdose, we're here to provide kind of informal peer support surrounding that experience. And then we do like advocacy and organizing work, and are really excited to kind of bring our community into that conversation. So if you're interested in learning more about some of the organizing work we're doing, feel free to reach out. You can see kind of in the corner of the screen, our website is there. All our contact information can be found there. And I will also share some links in the chat box. But yeah, that's a little bit about MAP. We've been, trying to navigate COVID-19 and, supporting folks through a respiratory pandemic for some time now. And and supporting ourselves and our partners in doing this work. And so, I think we've had the opportunity and the privilege to be part of a lot of different conversations where there's a lot of knowledge sharing. And so one thing that we wanted to talk about this evening was really kind of some of the COVID specific services that we provide, like what we can do to help, but also some of the new resources that are out there, just kind of briefly. So first off, we have access to PPE through our program. So we have a limited, but we have a supply of N95s, as well as surgical masks, and then disposable masks. So if you are getting mail delivery naloxone through our program, or you're someone who uses drugs and is looking to get some like PPE supplies, hand sanitizer, we're really happy to provide that. And so you can reach out to us at the number that I'm going to put in the chat box. It's 207 370 9445. Wow, I had a total brain fart.
It's been a long day.
Yeah, seriously. So feel free to reach out over text, signal, or phone call for access to, hand sanitizer, masks. And then we also are really hoping to support folks in getting some of the free at-home testing that's available. So we have recently learned and have some information on social media about both the federal at-home tests, rapid tests that people are eligible for, as well as those that are being distributed within the state of Maine based on your zip code. So I'm just going to put those links in the chat as well for folks to be able to access. For those of you who don't know, the federal government is offering any household 4 free at-home tests. So it's not per person, it's per household. It's a pretty easy process online. We have instructions on our social media, and we're really happy to support folks. You do not have to be the person to make the order for yourself, and we're happy to go through that process. If you have, lack of internet or broadband, like, feel free to give us a call and we can put that order in for you. And then, depending on where you are located, the state of Maine has, utilized a vulnerability assessment to identify zip codes that are at risk. And they are providing some free kits for folks in that zip code. So what I put in the chat box was the direct link to the federal website where you make an order through USPS, and then also information and directions through the state of Maine. So it's a government website. We also know that there's some new testing sites. Our friends at COSI, at the Church of Safe Injection, are putting a vaccination clinic on this. I'm looking for the date right now.
I think it's February 8th, but I can check.
It is February 8th at 1 p.m. at the Rest Center in Lewiston, Maine. They're going to have both Moderna and Pfizer vaccines for first dose, second dose, and booster shots. So that's really exciting. We're going to be sharing their information on that event on social media, but all are welcome to that. We will continue to kind of make sure that our community is up to date, and we're happy to provide you with some of this information over the phone or mail as well. Am I missing anything, Kristin?
No, I think, I've spoken to a lot of people too that just want to check in about what options they have, even if they're not ready to really take them around vaccination and testing. And also lots of folks that have wanted to reach out for other family members. We know you're taking care of lots of people in your homes. And so we have some information on that, as well as if you do test reactive, sort of the isolation period. And we're here to support you. Like, no question is a silly question. This is so confusing. There's so much going on. So please just reach out, and we're learning with everybody else, and we learn from all of you. So if there are questions around how to care for somebody in your home who's tested reactive, best practices, a lot of this stuff is kind of tricky to find. So, there are some websites that the Maine CDC has put out, but we also have that information, so you can reach out to us for sure. Sometimes it's nice to just talk to people about kind of what's going on, especially if you're the caregiver and you're kind of holding on to a lot of that. So we're here definitely for anything around how to put a mask on to, should I get vaccinated? These are the reasons why I'm not sure if I want to. Mm-hmm. Yeah. I don't think you've left anything out. I think we've given lots of options here for at least the testing pieces. Yeah.
For sure. Yeah. So I know, Kristin, like we've been providing a lot of kind of education to our naloxone distributor team and making sure people have access to the things that we've learned, and, really hoped to make that available today for folks. One thing I'll say is it seems like maybe we're not going live on Facebook right now. So for folks that we're hoping to get through Facebook, we're happy that you're here on YouTube and Twitch, but we're going to make this available ongoing on YouTube, and we'll put a post out. One other quick thing that we are providing is we have some of our favorite resources that just got posted on our social media. And if you go to our link tree, then you're able to access the web pages. So we have information from Vital Strategies, from
Rad Health Resources,
Wabanaki Public Health and Wellness. We have some articles from Filter. And so some of the folks that have been teaching us, we wanted to make sure that you had that available. And so you can find that again on our social media and our link tree. And then we've been putting out, different instructions throughout the month, and we're going to continue to offer some like really quick how-tos, whether it's about how to care for your N95 mask that we've been told we should be wearing, how to access your at-home tests. Happy to make those things available to folks both virtually, but also if you're someone that accesses mail, definitely happy to put it in the snail mail for you. Mm-hmm. So, Kristin, I'll kind of be quiet for a little bit and offer up some space for you to, do some of the education that you've been providing to the distributor team and to different participants of our program.
Thanks. So I think, most of what we've been talking about are things that we've now been dealing with for almost 3 years, right? And we've had to really adjust the way we all are living. And sometimes some of our practices, can always be safer in some aspects. And now with COVID and the pandemic, it can be really hard to just like stick with these extra steps. I remember early in the pandemic, I was wiping down my keys and my doorknobs and everything I bought at the store. So we've pivoted from that place, which is great. I'm very grateful. But, there's just a lot of being asked, and it can bring up a lot of different stuff for us. So, one of the big things we've been talking about is isolation. We know, for lots of folks, that's their ritual of how they use drugs, using alone. And there's lots of different ways that we talk to people about safety planning around that. But we also know that with the pandemic, people are extremely isolated, in ways that they aren't used to. So that can bring on a lot of different things, right? And so it can be trying to safety plan and not being able to do that the way you usually do that. It can be that people are having, their own hard times. So people that maybe were your peers or that you use drugs with or that you had for support, you find yourself in sort of a balancing act of supporting one another, which is always happening, but during the pandemic can be even more challenging. We offer the Never Use Alone hotline, which is an amazing resource that's staffed by harm reduction volunteers that folks will stay with you on the phone. It's a confidential service while you use your drugs to make sure that you have a safety plan, and they'll contact, you'll kind of like check in beforehand, give people your address and your location based on just the fact that if something happens and you're not responsive, that you've made that agreement that they'll contact support for you. Again, that can look different in rural areas, right? It's a really good safety plan, but we also know it takes a long time sometimes for support to get there. So really, we've just been talking about how people are coping with their isolation, how it might look different, how they're using their drugs during the pandemic. Most research has shown that the drug supply hasn't really changed, which is like being able to access your substances and access your drugs in the communities. But it has changed maybe in what type of drugs there are available, in what type of, if you are usually getting a certain analog of your Fetty, that can look different in certain areas. So it's not necessarily about the supply not being there, but it could be a different, not your drug of choice, a different drug supply, something else, there's a different cut in it. Maybe there's only the one distributor in your area, and that can lead to you're not able to drive further or get out, and transportation issues can always be part of it. So with the pandemic too, I think people have had to make different decisions to stay safe, and those are all really valid and okay. And that includes people who distribute drugs. So I think that's just sometimes can be part of a change that can be hard to navigate when you're not feeling well and you need what you need. So that's been something that we've been talking about with folks too. Then all of the sort of basics that we all know about not really sharing our stuff, right, has kind of amplified up during the pandemic. So I have a funny story of talking to a bunch of folks who shoot drugs, and we had a very good conversation about COVID safety protocols and wiping down all their surfaces, which a lot of folks normally do, making sure that we're not sharing even our works and our syringes. That's also a privilege in the fact of having access to everything that you need all the time. And we had this really good, probably about a half-hour chat. And then I went outside and everyone was smoking a joint, passing the joint around together, right? So we just are thinking, and that seems like, it's a totally natural thing to do. But in the era and the time of a pandemic and a respiratory pandemic, like Hilary mentioned, anything we're sharing that's touching each other's mouths, right, can be a huge safety risk and a transmission of COVID-19. So I think we've just been having to think about things like that, and making sure it can be hard. So if people are, a big one that we've talked to folks about is if your distributor when they deliver their drugs, they have it in their mouth. That can be a risk factor, right? And so how do you navigate that, talking to the person who you get your supply from about how they're actually delivering it to you for your safety, and for theirs too. And this is something that, when we talk about responding to an overdose in COVID, we're talking about, and this was something I really kind of struck me the other day, it's something I haven't thought about, but this idea that when we're giving each other rescue breaths, which is so important, and we know that's part of the overdose response to save one another's lives, there's also a risk factor from both sides, right? So if we don't know the person could be reactive for COVID. We don't know. Vice versa, we could be asymptomatic and have COVID and go in to give somebody rescue breaths with all the lovely intentions of saving their life, right? And then there's the transmission happening. And, I think as harm reductionists in our eyes, we want to keep people alive. We want to get them the oxygen they need. And, hopefully, with COVID, there's certain things that we can do following if that transmission happens, right, to keep each other safe. But just those ideas that we've just had to think about this really differently. And the community of people who use drugs save each other every day and take care of each other in so many different ways that, they're really the community that we look to learn about how they're navigating this. And so part of, and then I'll stop talking, but I think the one other thing that has come up a lot is withdrawal and, folks experiencing withdrawal on a regular basis, or that little cusp of withdrawal. So they just kind of feel really gnarly. And those are very similar symptoms to COVID. So we could have the flu, we could just have diarrhea, we could just feel nauseous, fatigued. All of those things can come into play. And we might not necessarily be thinking maybe I have COVID, I should get a test, or maybe there has been somebody I've been around that has COVID that told me they had COVID and I didn't really think about it. I'm just in withdrawal, right? And so that can actually lead to higher risk of overdose if we have COVID, if we're already not feeling that great, if now we're looking at a supply that might not be the normal supply. So we've just been talking to people about like thinking about these things, and, still making the smart choices they would always make, but just having a little bit more, thought behind each choice and being able to pause and kind of think about it like, oh, right. When you're sick and you need to feel better. And I think, COVID's really thrown a whole wrench into keeping each other safe. And then emotionally, when we're feeling, when our mental health's not the best, when we're not feeling connected to people, that can really just be hard, and really lonely. So that's another thing, like, we've been talking to folks with, just to know that it is normal to not feel okay right now, and to feel really isolated and lonely. And I think that's, part of it, part of why drugs work really well. And then we also just want to make sure we're thinking about how we're using our drugs during a time where we feel that height, because it can be really hard. Yeah, and I think that's really what we've been talking about together. And then having those hard conversations with other people, right? Like that maybe don't share the safety values you share, whatever, vice versa, like whatever way that looks can be, I know for me, that's been really hard. And so like saying like, hey man, I don't want to share that because of COVID, or, like there's a lot of different ways. So trying to talk people through that. And some people, I guess we can be really transparent and honest too. Like some people it is not their priority to worry about COVID. They've got a lot of other stuff they got going on. They need to survive. If they get sick, we've heard, and so having those conversations with people and just being curious about like what's going on for them. And maybe making sure they have all the education too, right? Because if you're hustling and you're, on the run and you're just trying to take care of yourself and be safe, you might not be getting all the health education about COVID. And maybe the stuff you are getting isn't always the truth, because we got a lot of that going on too. So just trying to be honest and curious about where people are at, which is the definition of harm reduction, I guess. So yeah.
Right. It's really about like having a harm reduction approach when our safety doesn't necessarily align with someone else that we're close to. And it gets exhausting, right? Like It becomes really hard, I think, to continue to have those conversations while we're experiencing so much loss, and fear and scarcity. One thing, Kristin, that I know like you've been bringing into a lot of the overdose education trainings and just in conversations is really like the specific impact that a respiratory pandemic or respiratory illness will have on someone's risk of overdose, and like the very real impacts that we're experiencing in our community because of that. And I think I was hearing you kind of talk about like how we're like adapting our responses, and I think one tool that we have and that we can provide folks with is, and that like sometimes we have already, is that if we're getting nervous about doing rescue breathing with someone, we can use shields, right? Like we have face shields that we can send out to people with your naloxone so that you have a barrier. But we also have masks, right? And so we have a shirt. And while like this is not like necessarily going to stop the transmission of COVID, it can be, one step that we take. And certainly using face shields, can be a step towards safety, and then taking, like you said, the other precautions that we know and other steps. So getting tested, having that conversation with someone, if maybe you find out that you are COVID positive and you have been in close proximity, that you've shared supplies, that you've given them rescue breaths, and also knowing that it's just so important to get naloxone into someone's system. So, I don't know if there was anything else you wanted to share on that, Kristin. It was just something that I've taken a lot of value in, that like before we're doing anything, we're just getting naloxone in someone's system, right? So give naloxone, start rescue breathing, call 911. Sometimes we have the luxury of having someone else there, right? So someone can be doing rescue breathing, getting naloxone in, someone else is calling 911. But really knowing that, you know, with both like a fentanyl based supply and the repercussions of COVID, to make sure that we're doing rescue breathing when we can. And if it just doesn't feel safe for us in that moment, to make sure that we're giving someone naloxone and getting the help that we need.
Yeah, that's brilliant. That's so important. And I think even in the moment, it's terrifying to respond to somebody overdosing and going into respiratory arrest. So, I think it's, again, totally normal to take a moment, and especially during a pandemic, to think, okay, what am I doing? Am I going to give them breath? I don't know. But if we're getting them that Narcan right away, that's the first step, right? We're moving into action, and we know how quickly, the message from the brain to the lung stops with fentanyl-based overdoses. So we just need to, there's no harm in kind of trying to think it through in the moment. But the good thing is we can get them Narcan right away, and that's a very minimal transmission, a very minimal risk for us for COVID. The one thing I was going to add is just folks who smoke their drugs. So that's another thing that I don't know if we're talking about enough, or at least I haven't heard enough, just around, our lungs, our lovely lungs, right? That's what are being affected by COVID, by overdose situations, like Hilary was saying. So, our care for our lungs in those situations, if you shoot your drugs and are not smoking your drugs, your lungs are maybe in a better place, maybe not, but maybe are in a better place, right? Than if you're regularly smoking. So just thinking about, like, if something kind of pops and you're not feeling great, or if you're short of breath, like just really looking into maybe why, and that doesn't mean necessarily going to get checked, but it might be good to take a test, right? So you can see, like, this is weird. I smoke all the time and I usually don't feel this like rigid, right? I usually don't feel like it's this hard and this short of breath. Something's up. And your body. So I think that's another thing. We unfortunately have the supplies we have for smoking, but I don't know if they're always enough for people to have them. So, like, it's asking people not to share those. Mark your pipes, put a little piece of tape on there, put a little, whatever you need to do, put a rubber cover on there so you don't burn your lovely lips, but it's also yours, and so nobody else has used it since the last time you used it. If you can do anything that marks things so that they're your own too, so you can kind of keep them safe and make sure that sometimes it's easier to do that than have the conversation like, hey man, I don't want to share. In my experience, I think smoking too, like, becomes as same as with injecting, but like, I think smoking also is a ritual for everybody to kind of pass it around. And so it's harder sometimes to say that to somebody. So if you have your own little one, you're just like, no, I'm good, I have it here, right? Pack your own, do all of those things that we can do on our own, which also makes sure that we get the right amount of the drug that we want, if we're packing on our own and doing our own stuff. So right now, that's even just more of an important point. And I wish that, we were able to get everybody as much smoking supplies all of the time that we could, especially during a respiratory pandemic. You'd think that would be a priority, but please, reach out to us, and we're always here to just talk you through it if there are issues that come up with that. The overdose, I think overdose response, I was going to say, using your masks to breathe for people is also something I think you had said, Hel. That's a really good point. Being able to breathe through your mask that we already have. And the other point is, if you do respond to an overdose of somebody that is symptomatic for COVID potentially, take your precautions afterwards. It's a lot to go through, and be gentle with yourself, but make sure, you wash your clothes right after that you had experienced, if you were with the person. And then if you do know they have COVID, or you suspect they have COVID, really that means if we're talking best practice, you should be in quarantine until you can take a test for those 5 days to see. And that's also for your, your safety too, to see how you feel. And it could be a lot of adrenaline going. So it's very hard to gauge how you're feeling right after you save somebody's life. And thank you for saving someone's life. But, so giving yourself some time to figure out how you actually feel might be a good idea too, if you can afford to do that, which a lot of people can't afford to. So, but then wear a mask, please, if you can, if you're not going to do that. Yeah.
Well, looking in the chat to see if there are any questions and not seeing any right now. I think that, we really like to figure out different ways that we can connect with folks. Part of it is making sure that we can get onto Facebook when we do these. So sorry about that. But, I think these are ongoing conversations that we want to have in a lot of different venues at MAP. So if you're someone that accesses one of our, mobile sites or our fixed site in Machias, have a conversation with the team there. We're happy to explore kind of what supports you might need. If you're someone who used to access our mail program, feel free to reach out to us. We are still here to provide support. And, we just, as a team and as a community of distributors, and we just value the work that everyone's doing to keep themselves safe and their people safe. I think that we've, as a community, we've been really good at that for a really long time. And I think that, the powers that be should always look to communities of people who use drugs and the folks that support them to kind of find those best practices, right? How do we show up for each other with unconditional love and support and care, and in solidarity, right, with each other. And so we're always open to different ways that we can show up to you individually or our community collectively. So be in touch with us in the many ways that you can: email, social media, text, call, signal. We're here. And we're here to, I think if there's one thing that we can really shine a light on, is that we're here for the hard conversations, or for the conversations that hold silence, right? Maybe we're just feeling really overwhelmed and we just need someone to show up and be there and be present. We are going to continue to provide kind of these tips of the month ongoing, and look to bring in participants and community members to help us provide these spaces for conversation and education and skill sharing. So if you're someone that, you have something that you really want to bring to the table to do a live stream on, or make sure that we have good program literature on, let us know. These conversations and dialogues are really intended to meet the needs of our community. And, we're exploring kind of formal ways to see what works and what's needed, but also the informal text is really great too. And again, this video will kind of live on YouTube, and we will be able to provide links to it on our other social media. Kristin, I'm wondering, I feel like we're kind of coming to a bit of a close, unless I'm totally off, but is there any lasting tips or thoughts or wishes?
Wishes. Yeah. I guess just also for you to know that our programs, our SSP programs across the state and our OEND programs, we're having these conversations about needs and what the community needs, but from what we hear from you. And COVID is being, really prioritized for good reason. But we also have to, remember that all of you we're in the middle of double jeopardies happening, right? And so I don't know if that's the right word, but it definitely feels that way. So, we are advocating for that, and that there should be specific funds for our communities who have gone through so much already. So just so that you know that, and if you're interested in supporting that, you can give us a call or text or signal. And I think just be gentle with yourself right now, and know that we are with you. And I know that when each of us speak to our MAP community members, we are there with you and feel it. So it's not, we also are feeling all of this as humans. And I think that isn't something about always having, there's no easy solutions right now. So I think what Hilary mentioned about just being together and being there for one another, in whatever way that makes sense for people. And a lot of times that means not talking about it too. And that's okay too. So if that means just moving through it without, whenever it comes up, it comes up. But we're here for that. And we appreciate you and love you very much. Yeah.
Well, thanks so much for spending time with us this evening or in the future when you see this. And I guess we'll log off. So wishing you all well, and sending a lot of care and love.
Stay safe. Bye.